We're joined now by Dr. Peter Lynn. He's CBC's medical contributor. Thanks for joining us today. There are a lot of invisible wounds after an event like this. Even for those who don't even live in Orlando, this has been like a really kind of sad news week. What are some red flags to look for?
I mean, I think all of us had that depressive feeling that as soon as we heard this news, right? And I think everybody went down into the dumpers for a little while. And then slowly we started to recover. So the key thing is the difference is how fast do we recover? So for all of us, we went down, if you want to look at it like a big landslide like this, and then all of a sudden we slowly get better. But there are patients that will now stay down there. And so therefore we're looking for those symptoms. We're looking for symptoms of anxiety, panic attack, depression. So anxiety would be the idea that you're fearful, so you're afraid of things. Some people might not go out of their house. Some people might be very jittery. You know, if you drop something, all of a sudden they jump and startle. So those are the signs that we're looking for. Panic attacks, this is where their heart beats very fast, like as if they're being chased. And so therefore we have a lot of those types of patients that will come forward now as well. And then depression, this is where your mood is down, you have no interest, you don't want to get up in the morning. Strangely, you're exhausted all the time, but you can't sleep at night, and so on and so forth. So those are the symptoms that we're looking for after this, because people that are likely to have mental illness, this will just push them over the edge a bit.
Okay, so if you see someone having these symptoms, or if you realize, maybe I'm having some of these symptoms, what are the people to do?
Yeah, so the first thing we need to do is maybe counseling and stuff like that. In other words, talking to people. And so the problem with it is sometimes very difficult for the person to feel it because they can't see that they're going into this area, right? It's like asking a person that's drank alcohol, are you okay to drive? Well, they're not the best judge of that.
Right.
Similarly here, they might not be the best judge of that. So in other words, speaking to people, and also the trauma people that deal with patients like this, they say, maybe we shouldn't have the TV on all the time where you're continuing to relive this over and over and over again. And maybe that's one way to insulate some of the patients that might be going through mental illness during this time.
That's interesting. Just shut it off for a little bit.
Exactly.
Tune out.
Just don't have it go over. It's like a Band-Aid. Don't keep ripping it open and open and open, and that's what's happening during our news cycle.
Now, what can doctors do if counseling isn't the best option for someone who needs help?
Yeah, that's interesting. Oftentimes you'll hear that the counselors have descended, and they did studies where they looked at that, and not every single person needed counseling. So it's very good for many people, but you might have some people that just said, you know, I just want to get back to the normal routine. So we have some people that just say, I'm going to throw myself at work. Maybe that's not the best strategy, but that's how they cope with things. There are other people, I was watching some of the news saying that they brought in some pets, you know, the dogs, and so therefore, yeah, and as they were petting the dog, everybody felt much calmer. And we've all had that sort of experience. So this is another way, pet therapy, for example. Some people turn to religion to try and find purpose and meaning in all of this stuff. And other folks, maybe they do need more than counseling. For example, they might need some medications like antidepressants, because some people, their chemistry gets shifted across in their brain, so they might need some other help. So it's a spectrum of things that we need to do to make sure that the right therapies is given to the patients.
But it's important to do something.
Correct.
Now, so these events are obviously extremely traumatic. Is there anything that can be good that comes from this?
Yeah, it's interesting. So we started seeing this outpouring, right? So I saw people lining up to donate blood and things like that, right? So just massive people wanting to help. And in a sense, that's how they're dealing with it. In other words, I want to help. I want to lay a wreath. I want to do something over there. And it's in a strange way, the death of these folks, these 49 people, wasn't in vain, because we started seeing people hugging each other, strangers, right? I mean, I'm in Toronto. I mean, I'm sitting next to somebody on the bus. We don't even say hello to each other because of all these barriers and hang-ups. And all of a sudden, with this horrible incident, it brought people very much close together, both locally but internationally as well. So we're seeing things coming in from all over the world, and it kind of transcends anything. It transcends ethnicity, religion, political beliefs, or whatever. People just came together. So in a strange way, if you want to think about something good, that's the good that's come out of it, that it brought people together. And I think that's a very hopeful story as we move forward.
It's interesting you mentioned the hugging, because after the shooting in Ottawa too, MPs were hugging. It was just everybody wanted to feel better.
Right. And isn't that strange that we often have this personal space that we don't cross, and yet that's exactly what we need. And so in a strange way, it brings back humanity. So if we want to talk about that, and I've noticed that the stories have now been about that. So I think when people are watching it now, they're seeing the humanity that's coming, and that's the good that will come from this.
That's a nice way to end. Dr. Peter Lynn, I want to thank you for your time today.
Thanks, Anna.
Dr. Peter Lynn is CBC's medical contributor.